Hi, my name is Jeff, and today is a pleasure for me to participate in the challenge video with all of you guys. The question is, what should be included in the teaching of asthma in Taylor's case? Taylor's been diagnosed with asthma while playing or exercising in a school. So today we're just going to talk about what should be included in the teaching of her asthma. So first, before we go into details, we're just gonna brush a little bit over what is asthma. Asthma is one of the chronic inflammatory disorder of the airway. So we all know that airways nowadays is a big deal in the health system. So it needs to get treated before we get too far. So when you're diagnosed with asthma, you'll need to go for medical treatment. Like I said before, go too far. One of the some of the symptoms that you'll be having for asthma will be shortness of breath, wheezing, coughing, and maybe some chest pain. Because, like I said before, asthma is one of the big respiratory disease that we are having lately. What can cause asthma? The risk factors for asthma can be exposure to smoke and family history of asthma. That can be some risk factors, and also the environment that you're in can also be risk factor for asthma. And some other thing that also trigger your asthma can be like being in a cold area. Those things can really trigger your asthma real quick, or exercising, or having some kind of emotions like being fear or laugh can also cause things like asthma. So you'll need to make sure you know what is the risk factors before you can actually go over the treatment for it. If you teach the family and the child of asthma, you will need to make sure you tell them how to properly use the devices that they're gonna use, because it's depending on the provider. They might use albuterol, which is a bronchospasm. They might use a corticosteroid. It's totally dependent on the provider. So you'll need to make sure as a nurse that you teach them how to properly use the device. If they're using albuterol, before they go exercising, like in Taylor's case, you'll need to make sure that you tell her to use it 5 to 15 minutes before she go outside playing. You'll need to make sure that she knows some of the risk factors, things that can cause asthma, so she can identify them. And you'll need also to teach the parents some of that. And if she's using a corticosteroid inhaler, you'll need to make sure you tell her to rinse her mouth after she uses it. And if she's using corticosteroids, you need to make sure also that you tell her to do that with food, because that's very important. You'll need to teach the parents to keep the child, or to tell them regularly to drink some fluid, because hydration is a good thing when you're treating asthma, because that can also prevent some of the treatment that you're going to use with the child. I believe this is going to be it. We're not gonna go too deep into the treatment of asthma or the teaching of asthma, but we'll see. I'll see you guys in a little challenge video. I hope the teaching was effective and going to be helpful. I'll see you guys in a challenge video again.